Good morning, Elevation Health friends and family. I want to welcome you to our episode this morning. We're speaking about diabetes do's and don'ts, getting ready for our upcoming diabetes and blood sugar control workshop. It's coming up on Monday, November 7th at 5:45. And this is important because November is National Diabetes Awareness Month. So half of everyone we know right now are either diabetic or on their way to becoming one. So we're going to be discussing in this episode the most important diabetes do's and don'ts. If you didn't know this, being diabetic or pre-diabetic significantly increases your risk of vision loss, neuropathy, obesity, heart disease, cancer, and Alzheimer's disease. Also, we know very well that people lose limbs. 60% of all amputations is due to diabetes. it's a terrible disease. It's highly degenerative because of how the blood vessels are affected and how far-reaching that goes into basically every cell, organ, and tissue in your body. So, the statistics show that normally diabetes is already en route, in progress, a good 10 years before it's diagnosed. And so I want to talk about common medical treatments. I mean, most of you know people who are diabetic and are taking insulin. And in medical journals, the Journal of Clinical Endocrinology and Metabolism, it was published showing that type 2 diabetics who take insulin injections die at more than twice the rate of those given non-insulin treatment. And the reason why is because type 2 diabetes is a disease of high insulin. And that means if you give more insulin, you're actually perpetuating and making worse the cause of the disease. So the obesity that comes, or being overweight with diabetes, actually causes more excessive insulin levels, which causes more weight gain. And then when you give more insulin, you're causing more weight gain, which actually increases insulin levels. So it's a vicious cycle. And that's why the fastest way to kill a diabetic is to give them insulin. Now, that may sound a little rough around the edges, but again, basically summarizing what medical journals are saying, that people who are on insulin die at more than twice the rate. The average life expectancy is reduced by 8 to 10 years for somebody who's taking insulin. So the best and smartest thing somebody can do who's taking insulin is to look for how to learn about correcting the cause of diabetes. Because if you start correcting the cause and the metabolism, and you start working on the liver and the damaged parts of the metabolism in the system and how the body's been affected by insulin and by sugar. Once you start zeroing in on that and correcting the cause of all this, diabetes goes away very quickly. Type 2 diabetes is 100% reversible once you begin correcting the cause of that. And that's what this workshop is all about. Taking medications is just a short-term solution, making things worse long-term. Another case in point would be metformin, probably the most common medication I see people taking for diabetes. If you didn't know this, last year it was recalled for concerns basically related to carcinogens, cancer-causing carcinogens, elements in the medications that people are taking, that your doctors are giving you, your family members, your loved ones, and giving it to it with confidence that it's okay, it's safe, but then being recalled. Again, the same thing with insulin is that it doesn't correct the cause. It's only treating the effect of diabetes, and it doubles your chances. The side effects are known to double your chances of dying from cardiovascular problems. Doesn't it sound somewhat silly to continue down the path that really just doesn't get to the heart and the root and the cause of why a person is manifesting disease? It's simple, but maybe it's like people say, it's not easy. There's a difference between something being simple and understanding it and actually applying it. And that's what we break down at the workshop. First and foremost, it's so important that people understand that the cause of type 2 diabetes is from too much sugar and insulin. And over a long period of time, that leads to something called fatty liver. Now, in the past, we would normally think that someone only gets fatty liver disease from drinking too much alcohol. But it's been well known and well established for a long time now that you don't have to be an alcoholic or drink alcohol to have fatty liver disease. You just have to have too much sugar over a long period of time. That's called alcoholic fatty liver disease. And more people have that who are not alcoholic than who are alcoholic. And eventually the liver becomes overfilled with the sugar. The fatty liver becomes unable to accept any more glucose and starts becoming insulin resistant. And the insulin resistance is an overflow phenomenon, not a deficiency of sugar in the cells. It's an overflow phenomenon. And so we've been misled, and this concept has been misunderstood for decades now. We're finally starting to realize what the cause of the problem is with type 2 diabetes. So in short, it's basically high insulin levels causing fatty liver disease, and fatty liver causes insulin resistance. And insulin resistance leads to more high insulin levels. It's kind of a conundrum, but it's a vicious cycle that just continues to repeat itself. And until we get to the cause of it and really start honing in on targeting what to do to correct this underlying dysfunction, nothing ever changes. Doesn't matter how many medications a person takes. Their condition is never stable. And it really just winds up ending a person's life early. People take more medications and they think that they're addressing the issue, but they're really not. And so the research is out there. It's all the answers are there for us if you're ready to tap in. As the old proverb says, when the student is ready, the teacher appears. Here's a large Accord study of more than 10,000 diabetics. The conclusion of the study showed the Diabetes Prevention Program research group study showed that lifestyle changes are even more effective than diabetes drugs such as metformin in reducing the incidence of diabetes in people at high risk with lower costs and fewer side effects. And this has been done over and over and over. So for those of you who are going to be watching this workshop, I can tell you right now, this is going to be a life-changing event. For those of you who would like to attend in person at our office, there's nothing better than being there live in person, and you'll definitely be able to soak it up being right there. I really break down layer by layer how to make a change and a difference with something like this, diabetes, and just getting right to the cause of it and start seeing the results right away, not having to wait, no delay, seeing results instantly, immediately. So you'll learn more about this, as well as strategies on how to stabilize your blood sugar level. It doesn't matter what age you are. How to lose your easiest 10 pounds ever. How to have better energy than ever. Also, in the process of reversing diabetes, show you how you're going to be preventing Alzheimer's disease, how you'll be preventing cancer, how you'll be preventing heart disease. Also, people ask me all the time, what supplements to take. And this is a really touchy subject because sometimes, we spend all this money on supplements and we think we're getting a clinical result and outcome. And really, it's just expensive urine. And so I'm going to show you exactly the top 3 research proven blood sugar stabilizing supplements that do get clinical outcomes, that do get results. So you'll learn all of this and a whole lot more at our workshops coming up here Monday, November 7th at 5:45. It's our diabetes and blood sugar control workshop, a life-changing event. It's going to be standing room only. I mean, we have very few seats left. So if you're in the office, I urge you to stand up. Just go up to the front desk. Make sure you get the names down of yourself, your friends, family members, loved ones, anybody who you're going to bring as a guest. Register now. So I thank you for joining me today. I look forward to seeing you there. I love and appreciate you. God bless.